Hello and welcome. Today we're shedding light on a painful but often temporary eye condition called photokeratitis. Sometimes referred to as corneal sunburn or snow blindness, photokeratitis can impact anyone, but understanding its causes, symptoms, and treatment can help you protect your vision. Photokeratitis is essentially a sunburn of the cornea, the clear front surface of your eye. It's caused by overexposure to ultraviolet or UV radiation. The most common culprit is the sun, especially when reflected off snow, water, or sand, increasing the intensity of exposure. Artificial sources like tanning beds, welding arcs, and halogen lamps can also cause photokeratitis if proper eye protection isn't used. Remember, even on cloudy days, UV radiation can penetrate and cause damage. Now, let's talk about what happens at the cellular level. UV radiation damages the superficial cells of the cornea, known as the epithelial cells. This damage causes inflammation and cellular death. Your body initiates a repair process, which involves shedding the damaged cells. While this regeneration is happening, the underlying nerve endings become exposed, leading to significant pain and discomfort. Think of it like having all your nerve endings on high alert. Photokeratitis affects people of all ages and backgrounds. The risk is increased for those who spend a lot of time outdoors in sunny or reflective environments without adequate eye protection. Skiers, snowboarders, welders, construction workers, and even frequent users of tanning beds are at higher risk. Geographical location also plays a role. Those living at high altitudes or in areas with prolonged sun exposure are more susceptible. The symptoms of photokeratitis usually appear a few hours after exposure to UV radiation. You might experience intense eye pain, a gritty or burning sensation, excessive tearing or watery eyes, blurry vision, sensitivity to light, also known as photophobia, redness, and even a feeling that you have something stuck in your eye. In severe cases, you might see halos around lights or even experience temporary vision loss. Diagnosing photokeratitis is usually straightforward. An eye doctor will examine your eyes, looking for signs of corneal damage. They might use a special dye called fluorescein to highlight any areas where the corneal epithelium has been damaged. They'll also ask about your recent activities and potential UV exposure to determine the cause of your symptoms. While photokeratitis doesn't have distinct classifications like some other eye diseases, it can be categorized by its severity. Mild cases involve superficial damage and relatively mild symptoms, while severe cases can lead to significant pain, vision disturbances, and potentially even corneal ulcers, although ulcers are rare. The severity depends on the duration and intensity of UV exposure. Thankfully, photokeratitis is usually a temporary condition. Treatment focuses on relieving symptoms and preventing further damage. This often includes using artificial tears to lubricate the eyes, applying cold compresses to reduce inflammation, and taking pain relievers. In some cases, your doctor might prescribe antibiotic eye drops to prevent infection or steroid eye drops to reduce inflammation more quickly. It's also crucial to avoid rubbing your eyes and wearing contact lenses until the cornea has healed. Prevention is key. The best way to avoid photokeratitis is to protect your eyes from UV radiation. Always wear sunglasses that block 100% of UV rays when you're outdoors, especially in bright sunlight or when surrounded by reflective surfaces like snow or water. Welders and those using tanning beds should always use appropriate eye protection, specifically designed for those activities. Remember to protect your eyes even on cloudy days. The prognosis for photokeratitis is generally excellent. With proper treatment and protection from further UV exposure, most people recover fully within 24 to 48 hours. Vision usually returns to normal once the corneal epithelium has healed. Recent research is focused on developing more effective treatments to speed up the healing process and reduce discomfort. Some studies are exploring the use of regenerative therapies to promote faster corneal repair following UV damage. And remember, if you experience any symptoms of photokeratitis, seek prompt medical attention from an eye care professional.